Bonjour, bienvenue à notre atelier de recherche du Département de Médecine familiale du mois de février. So welcome to our DFM research workshop session of February. My name is Maddie and I am the Academic Research Advisor and Senior Research Associate with the Department of Family Medicine. I work closely with Doug Archibald, who is the Director of Research and Innovation at our department, as well as with faculty members and residents on various scholarly and research projects. For the first hour of the session, I will provide a brief overview of research ethics boards in Ottawa, the type of projects and study designs that typically require research ethics boards approval, the application process, as well as key factors to consider when determining the need for REB approval and where to submit your REB application if you do require it. The next hour, starting at 6 p.m., we'll be joined by representatives of the Ottawa Health Sciences Network, the Health Sciences and Science REB at uOttawa, as well as the Bruyère Continuing Care Research Ethics Board. So during this panel discussion, we will invite participants to pose their questions to the panel. And we also have generated a list of questions we received from folks who were unable to join the session tonight. So on that note, I welcome everyone and thank you for attending. So today I'll be presenting a brief overview of REB in the Ottawa region, and I'll also present a few case studies where we can discuss as a group if you think REB is required for a specific project, as well as discuss the requirements for multiple research ethics boards applications. So the content of the presentation tonight reflects my own professional experiences with REB submissions and approvals. I'm not an REB officer, so if you do have specific questions relating to REB, I would highly recommend that you do consult with an REB officer at the respective research ethics board. So let's talk a bit to start off with project questions and study types. So your project question and the study design you decide to adopt to answer your question will weigh on the requirement or not for REB approval. So oftentimes we divide projects that we undertake under the umbrella of a scholarly project, which usually involves projects that do not require REB approval, such as a literature review, since the information is publicly available. And then research is a bit more involved, and usually human participants are involved, or it does involve human biological samples, and they typically require research ethics board's approval. There exist some tools to help you determine if REB is required based on a fillable checklist and guidelines. And I did provide two here on the screen. There's a research or QI guideline and checklist from the Ottawa Health Sciences Network, as well as the Bruyère Continuing Care. They do have that on their website, and I do have the links later on in the slides. There's also the online Iraqi ethics screening tool, which is a fillable checklist, and it lets you know the risk level of your study and its requirement or not, its likely requirement or not for REB approval. And again, so we will review these later on. So scholarly projects. These are projects that usually are less intensive, are scientifically less rigorous than a research project. You can have projects involving the development of an educational or a clinical tool with some evaluation component, for example. It involves a continuous quality improvement initiatives, a comprehensive literature review. It could be a project with a survey component. And these types of projects can require REB approval, but typically fall under the umbrella of literature review, quality improvement, and or program evaluation. So it usually does not require REB approval. And shortly, we'll go over ways for you to inquire and confirm if your project does require REB approval amongst the different research ethics boards. Briefly here, research projects are more complex and require more time to complete than scholarly projects. So for example, it could be a clinical intervention, the secondary use of data with extensive data analyses, etc. And a research project seeks to develop new knowledge on a topic, and it requires a larger time commitment to complete and requires usually REB approval. Research projects adopt a higher level of scientific rigor in the methodology and study design, and that's why usually they're typically more involved and usually of sufficient quality to be published. And again, at any point in time, please unmute yourself if you have any questions. I want this to be interactive. I did develop just about 30 or so slides of high level REB overview, but I'm happy to dig a bit more into the details if you do have questions as I'm progressing with my presentation. So I have listed here just the SMART and the PICO method adopted for formulating your study objectives and project questions. And these are some rules to keep in mind as laying out all these details early on will guide your study approach and data collections and analyses, and thus provide insight if your project does require REB approval. So just to provide you with an example here, as you're working through developing your project question, determining your study design to be able to answer your question, you want your project to be interesting, relevant within your field, answerable within your time frame, using the study design that you chose, and not already inserted another recent project or within the literature. And you want it to be as specific as possible. And I really like this trampolining example presented by one of our previous residents, Dr. Tennant here. I like how it clearly illustrates how you pose your question will lead to the adoption of different study designs to answer it. So let's say you were interested in knowing if trampolining helps with anxiety. Then you would need to rework your question if you intended to conduct a literature review. So your question might become, how effective is trampolining twice weekly in reducing crisis hospital admissions in teens with diagnosed general anxiety disorder? But then if you wanted to actually conduct a quality improvement project, then perhaps you would opt to formulate your question as, does attending weekly trampoline classes significantly reduce general anxiety disorder scores in a pilot program for teens at a primary care clinic? So these are just examples of how your question can take different forms, and depending on the type of project you conduct, it relates to different study designs and perhaps the different requirements for REB approval. Here are some other examples of projects that would typically fit within the realm of scholarly work, so not requiring REB approval, such as projects relating to literature review, quality improvement, and or program evaluation. So we have here a project relating to medical education. So we had, what is the value of critical event simulation for family medicine residents? So this is where a resident evaluated the efficacy of in-clinic simulation in the initial stages of residency at a primary care center. It involved a program evaluation with the administration of surveys to residents, and the data was utilized to develop a simulation scenario for first-year residents. So this was considered scholarly and did receive an exemption from REB approval. Second, here we have an example of a quality improvement project. So here it's the addition of an exercise is medicine module to the family medicine residency curriculum, improve the attitude, skills, and knowledge of residents on exercise counseling and prescription. So the purpose of this work was to develop an educational intervention for family medicine residents. The intervention was an exercise in medicine module, which contained a summary of current evidence, so information available publicly in the literature. It included physical activity guidelines and a clinical approach to physical activity counseling for patients with different comorbidities. The module was evaluated using a pre-post intervention survey at a single center, so within the researchers' affiliated clinic. And the survey measured changes in participant knowledge, confidence, and their perception. So this was an example of a quality improvement and did not require REB approval to lead the study. And finally, I'm sure most of you know about literature reviews, but I just posted an example here. We have the literature review titled, Does Vitamin D Supplementation Lessen Injuries Associated with Falls in the Elderly? So the scholar wanted to answer the question, does vitamin D supplementation decrease fall risk in the elderly? So the literature review was conducted in PubMed and Ovid to identify eligible papers, and a narrative synthesis was presented as a result of the study. So those are just typical examples of projects that would not typically require REB approval if you wanted to adopt or undertake a similar project. And I just wanted to add here a note about the pandemic and how it certainly impacted research activities and the way we can conduct them. So this is just to keep in mind when you are deciding on what type of project you will undertake, because recruitment of practices and participants might be more difficult in this time. And for research ethics, it involves using virtual tools that adhere to the privacy and confidentiality of information sharing, such as like the teleconference platforms such as Zoom. And these platforms have implications in the ethical conduct of research. And some REBs have restrictions in in-person research activities or require you to submit for special approval. So this is just something to consider if you're planning to actually conduct a study right now and apply for a Research Ethics Board approval. So just to summarize the previous few slides that we went over, again, it's high level. If you have questions, please feel free to ask. So REB is required when your overarching goal is to generate new knowledge and you want to generalize your findings. The information you are gathering is not anonymous or publicly available. You wish to publish or present your findings at conferences or workshops. You intend to implement a new intervention that is outside of usual practice, and your project involves human subjects or their health information. And then here on the right, we have the column where REB is typically not required. And that's when your project is framed as a quality improvement project, relates to medical education, program evaluation, it's a literature review. It does some chart audits, like if it's used within a single center for the purposes of quality improvement, does not require REB approval. So these are just a few examples, but what happens if you do need REB approval? So let's talk about the REB application itself. I will go over briefly the REB application in the next slide at the different REBs that are located within Ottawa to give you some insight about the process and the documents that are required and the time involvement with reviewing and waiting for a decision about if your project does require or not REB approval. The types of projects undertaken by our faculty and residents at the Department of Family Medicine typically undergo a delegated or expedited review, which is normally faster. So it's not considered a full review at the Research Ethics Board level. And because they're considered low risk to the population or to the participants involved in the study. So it usually involves methods such as like surveys or a focus group with participants or individual interviews, which is considered low risk. The initial REB review takes about 6 to 8 weeks. So make sure that if you do need REB, that you apply for it promptly to avoid any delays with starting your project. And this aspect should also be included in your study timeline as you're building your study protocol and trying to manage the timeline of your study. And I did include here the Iraqi ethics screening tool, which I think is a really excellent tool to support decision-making in terms of guiding if a project is high or low risk and the likelihood of requiring REB approval. And the tool has been co-developed and validated. And again, the link is hyperlinked here, and I will share the slides by email tomorrow. And so it assesses the level of risk of your project, the types of ethical risk, and the appropriate type of ethics review. So essentially, it aids you in identifying areas of ethical concern. And then if your project requires REB approval, then you will need to submit your application to the appropriate Research Ethics Board. And I've created a table here which lists the 4 REBs in Ottawa that we often deal with in primary care and some of the requirements and timelines for review. So I'll try to touch base on each of these here. So if you want, again, more clarification or more details, please unmute yourself or raise your hand and put it in the chat. And again, the links are all active and the slide deck will be shared with all participants by email. So briefly here, if we look at the first Research Ethics Board, which is the Ottawa Health Sciences Network, it requires researchers to complete a clinical research registration form via the IRIS homepage. And so once you access this CRRF form, so the clinical research registration form, then you can actually work your way through the different tabs to gather the information you need for your REB submission. So I've listed here some of the documents required in your submission, such as a study protocol, consent forms, recruitment documents, such as messages or emails or posters you'll be using to try to recruit participants in your study. You also need, for all of these 4 research ethics board, show proof of TCPS2 certification, which is bolded here on the table. And that's a Tri-Council policy statement. It's a Canadian guideline for the ethical conduct of research involving human or human biological materials. So you need to show proof or certification within the last 5 years. It's online. The TCPS2 certification is online, it's free, and it takes about 3 to 4 hours to complete. So that's something to consider if it's your first time applying to REB, or if you're due for your renewal, since it's been 5 years since you've last taken all these modules. And then here, the review timeline for the Ottawa Health Sciences Network is about 6 to 8 weeks for review. And remember, like the timeline listed here under the 4 REBs is for an expedited or delegated review. So if you need to have a full review of with the Research Ethics Board, it might take even longer. And then we have here Bruyère Continuing Care Research Ethics Board. So they use the COREB application form, and it can be downloaded online from our website. And it's submitted with like the required documents to the REB email listed here. So reb@bruyere.org. It takes about 6 to 8 weeks to review, but from my experience, it's much quicker. I would say within 4 to 6 weeks. And it typically requires the same documentation as the Ottawa Health Sciences Network and the other 2 REBs, in fact. So your study protocol, if you have one developed, your documents, your consent forms, recruitment messages. If you're doing interviews, you actually need to provide the questions that you're intending to pose to your participants so that they can review. Similar to if you're going to do a survey research, you actually need to submit your survey so they can review the questions and make sure there's no risk to the participants. Montfort is a similar process as Bruyère REB, where they request researchers to complete a COREB application form. And this is submitted with the associated documents to their REB email listed here at itzik@montfort.on.ca. The review time ranges from 2 to 4 weeks, so a little shorter. And finally, the University of Ottawa Research Ethics Board, so specifically the Health Sciences and Science Research Ethics Board at uOttawa, which is applicable for the Faculty of Medicine. Their REB application process needs to be submitted via an online portal, which is called eReviews, and takes about 4 to 6 weeks to review your application and then provide a decision. So please note that oftentimes after you're submitting your Research Ethics Board application, the REB decision comes back to you within the 4 to 8 weeks, but it's usually not an approved as submitted. So they often come back with revisions, questions, or concerns about your application. And they provide you with all like a list of these questions and concerns, which you have to address and resubmit via their online portal or email. So this adds further review time, and it's not considered within the 4 to 8 weeks. So this is something to consider when you're planning your study timeline, if the REB process can take up a few months to get it approved. So just remember that when you're going through this whole Research Ethics Board application process, you're submitting, your project cannot start until it has been approved by the REB. And then once you receive approval, if you do need to bring changes to your protocol or anything that was submitted and approved as is, you do have to submit an amendment and receive approval before you can actually implement your new changes to your study. So that's something to consider, so that your REB protocol or study protocol is not actually set in stone. If you do want to bring changes, you can, but it actually has to go through an evaluation process from that same REB in the as an amendment. And usually it takes a lot shorter than the 6 to 8 weeks approximation. So that's good news. And REB approvals are typically granted for 1 year. So when you're planning your study, if it's over multiple years, just make sure you put yourself a reminder that about 60 days before the due date, you should be submitting a renewal form to renew your REB approval for another year if your study has not completed at that point in time. And then when your study is complete, you do require to inform the REB so that they can close the study file. So let's go over some examples. So to see if you think REB approval would be required or not. And these are just simple examples, and we'll move into more complex issues and see where folks think REB approval is required or not, and where we should submit. So just for the first one here, so if the goal of the project is to increase knowledge of resources available to Aboriginal youth with depression, what if A, the data collection is through on-site visits to local service providers, and you want to conduct interviews with Aboriginal elders about their views on youth depression? So would you think that REB approval would be required for option A or not? Excellent. So I see we have consensus, and yes, it would be required, as it would be considered research. And it involves human participants. You want to interview them and then likely generalize your findings to publish or present at conferences. So Research Ethics Board approval would likely be required for this project. What about option B? If you just want to do a literature review and a compilation of information gathered from various databases, such as PubMed, Ovid, the University of Ottawa Library. Excellent. So we have experts in our participants. So that's wonderful. Exactly. So I see the consensus is not required. And that's because it's a literature review and the information is publicly available. So typically a Research Ethics Board review would not be required. I have a second example here to present. So you want to survey family medicine residents at the University of Ottawa to measure awareness of the Canadian Association of Radiology referral guidelines. So for the first option here, you want to assess if the University of Ottawa Family Medicine program is providing adequate teaching on the CAR guidelines to our family medicine residents. So do you think it would require Research Ethics Board approval or not? So we have a lot less answers, but I see it's not required. So if you have questions about the example, please feel free to unmute yourself. But yeah, you are correct. It's not required. Typically, that would fall under like quality improvement or like program evaluation or medical education. So that would not require REB approval. And then the last one I have for you is you want to explore if the resident knowledge of the CAR guidelines and understand what are the possible barriers or opportunities to integrate guidelines into residency training more generally. Excellent. So for this specific example, it was required and it was considered as research just because for this study design, they interviewed different family medicine residents within the entire program. So they did require Research Ethics Board approval so that they can review the interview questions to conduct the study. What about multi-site Research Ethics Board's applications? So right now I just listed simply like if you need REB approval, here are the 4 REBs that you would likely need to apply to depending on different factors, which we're going to go over to now. But what happens if you're affiliated with more than one hospital or one or more clinic? What happens if you decide to recruit participants at multiple sites? So we'll just go over about the requirement or not for submitting your applications to different research ethics boards. So usually if your project involves multiple institutions, oftentimes multiple REB approvals are required. So unfortunately, in Ottawa, we have lots of research ethics boards approval, and I hope one day we'll have a more streamlined process to offer researchers and scholars. But at this point in time, if it does involve multiple institutions, you would have to obtain approval from each of these REBs associated with each of the institutions. And so the primary REB, which is known as your board of record, is usually selected based on your affiliation. So the principal investigator affiliation. So for example, if the researcher is a personnel from the Ottawa Hospital or the Ottawa Health Research Institute, it would require to go to the Ottawa Health Sciences Network REB for approval. And this is regardless of where the research is taking place. So if they're affiliated with the Ottawa Hospital, but their study is actually happening in Bruyère, they would need to apply to the OHSN REB either way. And then the requirement for other REB approvals is based on where the research and the recruitment participants is taking place. And I have a couple case examples here to provide you, and then we can have a discussion about those. And these are a bit more tricky because it involves multiple REBs. And keep in mind that usually when you apply for Research Ethics Board approval, you'll have identified your board of record, which is the primary REB that you would apply to. And then the other REBs would be considered administrative or secondary REB reviews. So usually they don't take as much time, and you would submit your approval letter from the board of record to show that it actually has undergone at least primary review from another Research Ethics Board. So where do I apply here? So I'm a principal investigator. I'm a senior investigator at the Bruyère Research Institute. My co-investigators on the team are faculty members of the Department of Family Medicine at the University of Ottawa. The participants are family physicians and residents recruited via the Department of Family Medicine. And my patient partners will be recruited from the MALFAL patient program. So I'll give you a couple minutes just to think about it. You can either unmute yourself or put it in the chat. Where do you think you would apply? And you can name your board of record, so your primary REB, and then potentially other REBs you would need to consider submitting for administrative review. Excellent, you folks are really good. So yeah, so your board of record would likely be the Bruyère Continuing Care based on the primary affiliation of the senior investigator on the research team. So he's the one overseeing the study activities. So Bruyère Continuing Care would be the board of record, and then other research ethics boards that you would need to apply to would be the uOttawa Research Ethics Board, because your co-investigators and your participants are members of the University of Ottawa Department of Family Medicine. And because you're involving patient partners from the MALFAL patient program, you would require the MALFAL REB. So where do I apply? The principal investigator is duly appointed to the Bruyère Research Institute and Department of Family Medicine at the University of Ottawa. The co-investigators are faculty members of the Department of Family Medicine, and participants are patients from the Ottawa Hospital. So the board of record would be the Bruyère Continuing Care Research Ethics Board. And then your other REBs here would be considered the University of Ottawa REB, just because your co-investigators are faculty members of the department. And because your participants are patients from the Ottawa Hospital, you would need OHSN REB. And let me just go over the OHSN REB requirement. So Dr. Venables, I will get back to your question after. So for the OHSN REB requirements, so research involving the recruitment of the Ottawa Hospital patients and or staff also requires OHSN REB approval at all times. And then if someone wishes to recruit the Ottawa Hospital patient and or staff, there's another caveat that you need to name a principal investigator at the Ottawa Hospital. And they're the ones who are going to be overseeing the study at the Ottawa Hospital specifically. And here would be for the recruitment of patients from the Ottawa Hospital. So even though the principal investigator is not is a Bruyère Research Institute member, they would need to identify an Ottawa Hospital investigator for the purposes of the study. And so OHSN REB review is only required in two cases. So when the research is conducted by the Ottawa Hospital or Ottawa Health Research Institute personnel, regardless of where the research is taking place, and if the research involves the recruitment of the Ottawa hospital patients and or staff. And I'm just going to read Dr. Viner's question here. So having a project occurring at the Ottawa Hospital Family Medicine, but involving researchers at University of Victoria, BC, does a second REB application have to be done there? That's an excellent question. And again, I'm not an REB expert. This is all based on my experiences with multidisciplinary teams. So my take on this would that you would have to have your board of record being the OHS and REB, and then you would likely need administrative review at the University of Victoria. So they're REB affiliated with that site. And this is if the researchers are co-investigators. You don't need, if you have like collaborators, partners, or other types of team members, you don't need to go to their affiliated research ethics board. But from my experience, it's at the level of the principal investigator as well as some of the co-principal investigators. I hope that answers your question.
I have a question, Maddie.
Yes, go ahead.
So for the principal investigator in this situation, he's dually appointed to both the Bruyère and the University of Ottawa. I'm just curious why the board of record is Bruyère and not uOttawa. Like, is that something? Does the Bruyère trump uOttawa? I'm just not. I'd just like some clarification about that.
Yeah, I have to be careful how I say this because I know we have representatives from the different REBs. From my experience, it's a lot simpler to apply to the Bruyère Continuing Care Research Ethics Board with having the application being downloadable and then submitting by email with the associated documents. So that's why I would have listed them as a board of record. But you are right. The board of record could have been the University of Ottawa REB. And you could have went through them, receive approval first, and then Bruyère Continuing Care could have been the other REB involved here in this example. So you're correct. You could have used either or.
Okay, but just to clarify, both of them need to be involved.
Yes, exactly.
Sounds good. Yeah. Thank you.
For multi-site REB applications. So what you should do is identify the board of record, just as what we've done here with the previous two case examples for your study based on your affiliation, and then affiliation or the study type. So if you're conducting the research at the Ottawa Hospital, that would likely be your board of record. And then you would submit your research ethics board application to the board of record. And then you would identify other REBs that would be required for your study as applicable. And what I usually do is I wait once I receive approval from the board of record, then I apply to the other research ethics board and include the approval letter in the submission. And usually that indicates to them that it has gone through a thorough review by your board of records. So it's usually considered like more of an administrative review, and the process is a lot shorter. We're talking about 2 to 4 weeks instead of the 6 to 8 weeks. What if you're public, if you want to publish, does that require REB? Or what if you don't know if your project requires REB? There's some elements of quality improvement in there, but you know, you're doing a bit of research involving participants, so you're not quite sure where it weighs in and where it falls. So what I've done here is I've listed the 4 REBs, and they have a process where you can submit, most of them is a 1-page project summary, as well as completion of a research or quality improvement checklist, or complete the Iraqi ethics screening tool. And you submit that, and then they can quickly review and let you know if your project does require research ethics board approval. So let me just go through each one here so it's clear. And if you have questions, please don't hesitate. So usually for the Ottawa Health Sciences Network, REB, you can submit is your project research or quality improvement. And that's exactly, there's a couple pages of a guideline of what is considered research versus quality improvement. And then you complete a checklist. You submit that with a 1-pager of your project summary to the REB administration at toh.ca email, and then they can review and let you know if you would require REB approval. So instead of, if you're uncertain instead of actually going through the whole process of submitting an entire REB application, which is quite timely. Then you can actually see if it does require REB approval before going through this whole process. Fall, you would submit your study protocol, about a pager, to Joanne Pomerleau here, listed here for review. And they also ask you to complete the Iraqi ethics screening tool. So you can download the response. It tells you if it's low or high risk and the areas that might be of ethical concern. And they use that in their assessment to see if you were required to submit for REB approval. BCC here, which is Bruyère Continuing Care. You can submit a one-pager, as well as they have their own research or quality improvement checklist, which is very similar to the Ottawa Health Sciences Network. You would submit that to their email. And then for the University of Ottawa REB, I usually email them or call them. They don't have, unless they can correct me, they don't have an official process of inquiring if you require REB approval in terms of submitting a summary of your project or another checklist. I usually just email them and provide that information in the email, or I call them directly. And for publication purposes, for your quality improvement, your medical education study, whatever activity you want to undertake, if you plan to publish, I usually inquire through those 4 different steps here listed on the screen about the requirement or not for REB. Because what happens is that if your study does not require REB approval, they'll send you a confirmation letter. It's a letter of exemption. So confirming that your study was reviewed and it fits under the umbrella of, let's say, of quality improvement or program evaluation. So not necessitating REB approval. And this is super helpful when you go to publish to journals, because oftentimes the journals will require proof of ethics. So if you have that letter of exemption, then it's very easy to actually submit it with your manuscript. And then there's your proof that you actually did your ethical duties. You submitted and inquired about if your project does require REB, and you have proof of that.
But I'll do some comments for the University of Ottawa.
Yes.
About the the requirements for REB review. So we actually usually use Ryerson has like this grid for QA, QI and program evaluation. So when people ask us the question, we often ask them to complete that grid, and we can send them the link, or we just send them the document itself, which we actually got translated, so it can be available both in French and in English. But the document from is it the University of Alberta? It could also be completed, right? I mean, it's another good document. The other thing I just wanted to mention is regarding the multi-jurisdictional review and the expedited review of the multi-site. So the requirement for the TCPS for delegated review is that the study be minimal risk. So I just want people to understand that if they have an approval from one site, if the study is above minimal risk, according to the TCPS, you can't do a delegated review. Now, most of the studies that we see are minimal risk, so it's not an issue. But that's just a limit of the TCPS currently. Hopefully they'll decide to change that at some point. But right now, that's a limit of the expedited reviews for multi-jurisdictional.
Could you just review the TCPS2 certification? I haven't heard about that before, so just wondering what exactly that was again.
Yeah, so it's just a Canadian guideline that is used and requested from scholars and researchers that are doing clinical research involving participants that are human or human biological samples. And it actually just goes over the process of like risk and what you need to consider in your study design if you are involving human subjects. So most of the REBs, well, the ones in Ottawa anyways, do require that you go through this online module. So I forget how many modules, because I've taken it now, I think 4 years ago, but yeah, it's a series of modules about clinical research, what you need to consider, what involves low and high risk, and then you receive a certification once you completed the modules. It takes about 3 to 4 hours to complete, to read all of the material, and then with that certificate, then you can submit that with your REB application. And it's a requirement from usually from the principal investigator and the co-principal investigators listed on your study, as well as the staff. So just to keep that in mind, it does involve your whole research team that is included in your REB application. So now it's my pleasure to move on to a panel discussion. So we were able to bring Dr. Carolynn Paquet, who is the Director of the Office of Research and Ethics and Integrity at the Health Sciences and Science uOttawa Research Ethics Board. So thank you for joining us today. We also have Carolynn Warnet, who is the Bruyère Continuing Care Research Ethics Board Coordinator. So, and I think Amy Geertsma from the Ottawa Health Sciences Network will be joining us. So I wanted to bring representatives here today to answer any of your questions relating to Research Ethics Board. I do have a list of questions that folks have submitted that were unable to attend, so we can go over those as well. But I just want to open up the floor first to see if any of you here today on the call have questions for Dr. Paquet or Carolynn Warnet about Research Ethics Boards. So the question is, if you have ethics approval from your board of record, is only an expedited review necessary from other research ethic boards? And I think Dr. Paquet, you did refer to some of this previously. So if a full review is necessary, how do we know and why? And for example, if the Ottawa Health Science Network Research Ethics Board was your board of record and approved your study, do we only need to submit an expedited review to other research ethics boards going forward, even research ethics boards across the country?
Yeah, I can start that off. Just to specify, I'm not a doctor.
Oh,
just call me Catherine. So regarding the question of whether or not it would be expedited review or not, I mentioned it a little bit before, right? So one of the things about the multi-jurisdictional review is that the study, first of all, has to be defined as minimal risk according to TCPS. So normally that means that the risks are not above those that are, experienced by participants in their everyday life. The study doesn't bring additional risks to the participants. Now, there's an exception for studies that are, for uOttawa anyway, for studies that are at one of the affiliated hospitals, because we have an agreement in place. So for us, it doesn't matter if the study is above minimal risk or not. If it's been approved by any of the affiliated hospitals, we will do an expedited review or an administrative review for that project. But if you're going to be submitting to other REBs across the country, for example, that may not be the case. Now, the thing to note is that it's not because your primary REB reviewed something as full board that the other REB will agree. And it's not because your committee reviewed it as minimal risk that the other REB will agree, because there's some differences in terms of risk evaluation across the country. So we've had to go either way at the university when people have submitted studies that were approved elsewhere. We've, seen some studies where, there was quite a bit of high risk and intervention, and for some reason the primary rep considered minimal risk, and we kind of said no, it has to go full board. It doesn't happen too often, but it's happened a couple of times. And the reverse has happened as well, where something was submitted as a full board. For example, some REBs see all research with children as a full board review. We used to do that, we don't anymore. So we can do a delegated review if our REB feels that it is a minimal risk study. But that is the reason why. So it really is a TCPS requirement that if it's something, you can't do, unless you have an agreement in place, you can't do a delegated review for full board.
And I can echo that, yes. So we review according to risk. So under Article 6.1 of the TCPS2, it basically states that we need to conduct reviews on research, whether it's happening at our institution or whether the investigator is conducting it elsewhere, external to the institution. So under 6.1 of TCPS2, I would encourage you read that. And like Catherine Paquet says, that if you don't have an agreement, the REB's decision for review is according to risk. So whether it needs full board review or whether it needs delegated review, minimum it would need an REB application for review. So we also, across the province, in Ontario, we have something called Clinical Trials Ontario, which is a harmonization review CTO stream system that investigators can if their institution is a participating site in Clinical Trials Ontario, and Clinical Trials Ontario is not just clinical trials, it's also observational or delegated reviews as well. And if your institution has a participation agreement, it can be submitted through CTO, where there would be one board of record assigned to do the review on behalf of on all of the participating sites in Ontario only. So CTO stream is the harmonization agreement. There's an agreement with each institution that participates that allows a harmonized review where one board of record across Ontario reviews, and for not only that lead site, but all of the participating centers as well. If you were applying through WCHIO, right now with the OSIN REB and CHIO, we have an agreement put in place where it starts with a REDCap system. And so you would submit a REDCap REDCap survey, and both boards take a look at it to see which board of record should review, CHIO or OSIN. And we make a decision on which board of record will, and whether it'll be a collaborative review. So if OSIN REB is chosen as the board of record, CHIO members may be invited for collaborative review, or vice versa. CHIO might be board of record and we're invited. So that's a different type of agreement that we have in place with CHIO, and that's to help with cross-appointed investigators who are conducting research not only at TOH, they're also conducting it at CHIO, or they have responsibilities that they need to report to both institutions. So historically, if the study was only happening at CHIO or at OSIN, that investigator, because they were cross-appointed, would need to apply to both boards. And this agreement allows that process to allow the boards to communicate to instruct the best pathway for this investigator to go, allowing one board of record to be chosen to review, whether it'll be an independent review or whether it'll be a collaborative where we invite members from another board. Bruyère is a different situation where we don't have an agreement in place with Bruyère yet. So unfortunately, for an investigator who's going to conduct research at both Bruyère and at the Ottawa Hospital, it would be independent submissions at this time. So we are working on an agreement to put in place where we have that same kind of approach that we have with CHIO, but an agreement is not in place yet. So it is a submission to the OSIN and a submission to the Bruyère at this time.
And just a follow-up question, Amy, for the CTO, is OSIN, now I learned that OHSN is actually, it said OSIN now, so that's good. Are they always the board of record for CTO, or the board of record actually moves?
It moves. So there's 18 qualified boards across Ontario, and so any board could be chosen. The only issue with CTO is that if it's investigator initiated and a grant funded project, more than likely it's going to be attached to the host, the REB that's attached to that host institution. So if it is investigator led project from TOH, 99% chance we're going to be chosen as the board of record.
So we have a question from Dr. Viner, one of our participants in the chat. So he's asking, he's unsure about how to determine if a protocol modification is significant enough to warrant REB resubmission. As well, when the team changes or additions are made to the team, does this require reporting to the REB?
I don't know, Amy, if you guys have like specific criteria, but usually for one of the things that will influence is whether the documents need to be changed. So for example, if you list the co-investigators on your consent form, which usually happens for our REB, you would need to submit new consent documents if the team changes. So for that reason, you would need to get, you would need to submit a request for modification and submit the revised consent forms. It really depends on the nature of the change, but usually if it's something that affects participants, it will require a change. It will require a request for modification. I would say that's generally like a pretty safe bet. any documents or any, obviously any impact on participants. It's like a clinical study and there's an impact on participants, obviously that would require like a modification as well.
Correct. I agree. For any amendments, we call them an amendment submission. So it'll be any change to the protocol, consent forms, any participant-facing documents, and certainly staff changes as well. So our application only requests that a principal investigator, obviously is on the application, co-investigator, and the most applicable co-investigator, meaning this would be the person that would correspond with the REB if the PI was absent, and a study staff person, study coordinator, usually is what we ask. We don't ask for the whole list of co-investigators on the application because we know that things change over time. So we only ask for one, and all of the rest of the local co-investigators that are in part of the study would be listed on a delegation log. And their duties that they would fulfill of the study would be documented on that delegation log. But certainly if somebody was to leave, like a co-investigator, PI, or study staff was listed on the application, that would require an administrative change.
If I can just also add from our perspective at Bruyère, if there's new staff, new investigators, we also require that they complete the TCPS2 certificate. So that also needs to be submitted with any amendment change, as well as a signed confidentiality pledge for the particular project they're working on.
So one member is asking, if I want to start any research, do I need to apply for REB approval exemption from the board governing my work contract? So for example, if I'm employed by the Department of Family Medicine, that would be the University of Ottawa, or from where my potential participants will be from or recruited from. So Bruyère or TOH if studying patients in either facilities or both.
I would say if you're recruiting patients from the Ottawa hospital or any other hospital, it might be a good idea to start with them. If we've had cases where, faculty of medicine and staff have gotten an exemption from the OSIN REB, and I haven't seen a case where we've disagreed, or there's been a quality assurance study or something like that. I mean, if the hospital determines that something is quality assurance, the university rep is not going to say, no, it's not. So I would say if you're doing that, then definitely start at the hospital. You probably would need an exemption from both, but that's a pretty quick thing on that side.
So is that to start a contract, the contract process, or?
No, I think it's just really trying to determine which REB to apply to. So they have a work contract with University of Ottawa, but their participants are actually from Bruyère and the Ottawa Hospital. Okay. So do they need approval from all three, or just where their work contract is situated? So that's the University of Ottawa.
Recruiting patients from a hospital, they'll need approval from the hospital, and we would say in many cases it's probably appropriate to go to the hospital first.
So the difference is with TOH is that you, in order to submit to our OSIN REB, I'm not sure where all of the faculty members sit with their appointment status at the Ottawa Hospital, but in order to apply to OSIN REB as well, you need an appointment. So the family medicine staff would have to be an appointed person at the Ottawa Hospital in order to submit to us as well. If they don't, they need to find a PI at the Ottawa Hospital that will be able to submit for them and conduct the study. So we've had a couple scenarios where there's been staff, I think, from Bruyère and U of O that do not have an appointment status at the Ottawa Hospital. So those folks would have to apply to their local hospital and then treat our site as a participating site, meaning you would find a PI from the Ottawa Hospital to submit for you if you don't have that appointment status at the Ottawa Hospital to apply to us.
What about community primary care clinics? So where would they apply for Research Ethics Board? If their participants are from their primary care clinic in the community, They are faculty members from the Department of Family Medicine, but of course they're working in the community. So would that be the University of Ottawa REB?
Yeah, most likely. I mean, if they're not recruiting through the hospital, they would normally have to submit through the University of Ottawa REB. And, you know, they would need some kind of permission from the community clinic or whatever, but, you know, they don't usually have separate REBs. So they would submit through our REB.
And I would say if it's a TOH appointed person and part of the faculty medicine, they would apply to OSIN REB to obtain approval. Now our approval letter, this is kind of a slippery slope, like I say, because our jurisdiction does not cover the community areas. And when we're reviewing an investigator's research where it's being conducted in the community, and keep in mind that these are minimal risk studies, we wouldn't approve a clinical trial to happen in the community. So these are minimal risk studies, and we're reviewing it according to that 6.1 rule of TCPS2, where one of our investigators is conducting a study elsewhere, and that would be within the community. Now it's up to the community to accept our OSIN REB approval, because we do not say you have approval to run the study at this community center, because our jurisdiction doesn't allow to conduct review for that study to happen at that community center. So our investigator gets approval in his name on behalf of TOH, and then the community center where he or she is conducting the study, they have to assume and accept our REB approval, which usually is the case. But we only do it for minimal risk studies, not clinical trials. And that's simply because clinical trials, we don't, because like I said, we don't have jurisdiction over that. OHRI administration has also, you know, we can't say for sure if they have all regulations in place, all of the training requirements, and what kind of quality assurance they have. And our facilitating team, as part of OHRI administration, can't just go in and review records at a community center and that. So that community center has to be fully operational and ready to run a clinical trial, regulations wise, have all the proper training in that. So that's why we just don't provide approval for that site.
Yeah, and maybe just bring it back, because a lot of the questions seem to talk about like the why of the requirement to submit to multiple REBs. And like Amy said, it really is related to Article 6.1 of the TCPS that says anything done within the jurisdiction or the auspices of an institution has to go to that institution's REB. So that's why if you have co-investigators at other institutions, like you said, not RAs or not, you know, collaborators, but co-investigators, they also need to get approval from their REB if they're on a study, because work is being done under the auspices of their institution. So if they're at U of Calgary or UBC or U of Toronto or uOttawa, it can be a delegated review, but it has to be reviewed currently under the TCPS.
As we start to move beyond simply conducting research from an Indigenous perspective to actually researching from an Indigenous paradigm, how familiar are REBs with applied Indigenous research methods and methodologies? And are these sent to First Nations community REBs for consults?
I can answer for the university. So we've had an Indigenous member on mostly our social REB, actually, because we don't get a whole lot of studies involving Indigenous communities on the health REB. But the TCPS does allow for, you know, getting ad hoc members if we need it. So if the REB is reviewing a study and there's methodology that the members are not familiar with or not comfortable with, or just don't feel that they have the necessary knowledge to review, then we can go out and get somebody who's got expertise in that particular area. The studies we've seen, especially, I speak more to the social REB, but usually it's pretty similar to other stuff, and they see a lot of different methodology, everything from like arts-based research to, you know, qualitative or quantitative research. So it hasn't been a problem so far. It definitely needs a little bit more flexibility and an open mind, I think, for some of these methodologies. You have to kind of be able to change your paradigm a little bit. But so far it hasn't been an issue for the university REBs anyway, in terms of the methodologies. I think the researcher's job as well when they submit is to clearly explain what they're doing and why it's appropriate in that particular context. I still hear stories of people from other places saying, you know, I was asked to get signed consent from Indigenous participants, and unless, I think maybe if you're doing a clinical trial, you may not have a choice, but if you're not, then it's definitely not something that you should be asking if it's not appropriate for the particular community where things are taking place. So you just have to, you know, the researcher should be explaining how he's doing the study and why. And if it's well explained, the REB should be able to understand it. And normally there aren't too many issues there.
Well, I would say we don't have a lot of research that is including populations of Indigenous communities, and certainly not a lot of research that is focusing on those communities in particular. So we don't have a paradigm, I would say, at the Ottawa Hospital. So we have a few studies where they are going, like, their population is broad. It's also going to include Indigenous populations. And we have a member from Indigenous communities to review our projects as well. So we actually don't at TOH have somebody designated. There's no employee that's putting policies or procedures in place to carry this out. And I think we're starting conversations about, especially about open access to data and what happens with that, because I think there's a real concern about the data and samples that are collected. And it's not so much about the, I would say, the data and samples that are collected. It's based off basically two things: who controls it and what are they going to be used for, especially in the future use. So we're starting to have those conversations. I know Dr. Sagner is involved with some of that, but it's been slow moving because, like I say, we just don't have that type of research happening at the Ottawa Hospital. Definitely not. I think there's one physician that is looking to do research like that, but we don't have a lot of it where the focus is on in the Indigenous communities. But certainly we don't exclude anybody from Indigenous communities wanting to participate. I think the investigators that have been involved looking to do this research, it's a lot of extensive community consultation first that has to happen upstream before it gets to REB. And so I think that's where we're at right now, especially with these COVID studies.
Yeah, and that's a good point. I mean, the community consultations are very important in that context. And again, that's another thing where it's expected that the researcher will do that work and will build that relationship with the community, and that's what the REB wants to see. So you have to know that any particular community wants, and the REB will usually respect that as well, right? Whether it's like verbal consent instead of signed consent, or where the data is going to be conserved. Those are things that the discussions have to take place with the communities before the researcher comes to the REB.
And as a follow-up to that question, someone was asking about, I just posted in the chat for you. So along the lines of data management and storage, right? So if the wish is to respect the OCAP principles, which defines the necessity of Indigenous research data, ownership, engagement, and governance, do REBs accept that data management be with OCAP as opposed to be located within the university or the research institute itself?
I think those discussions have to take place with the communities. And again, OCAP applies to a group of people, but not all. For example, it doesn't represent the Inuit, it doesn't represent Métis. So it may not apply to everybody. The ones that I've seen sometimes have shared agreements. So the community will keep, for example, a copy of the data. But at the same time, the researcher has to be able to publish. And there's also responsible conduct of research questions that have to be ensured. So, if somebody questions the publication, the researcher has to be able to say, well, here's my data and, this is where it's from. So, in some cases, it may not be appropriate for it only to be kept within the community. There's also the case where some communities just don't have the capacity to retain that data in a safe manner. So really, there has to be a discussion, and the data has to be kept safe, especially if there's identifiable data in there, like names, or if it's health data, that's even more sensitive. So there's different things to keep in mind, but the OCAP principles definitely would play if you're dealing with communities that it applies to.
Is there an option to apply to any one REB for a simple, non-intrusive, anonymous survey or second data collection study? And what is the quickest, best REB to apply to? But I guess that's based on the researcher's affiliation and then where the secondary data resides and stuff like that, right?
Yeah, the only thing I would say is you can't submit a clinical trial to the university. So Health Canada defined clinical trial. We don't have the REB membership to cover those. So that's the only thing. If there's an actual real clinical trial, it has to go through one of the affiliated hospitals as a primary REB. Apart from that, there's some studies that are more appropriate if somebody has a double affiliation. Some studies are more appropriate for the university, and there's other ones that might be more appropriate for the hospital. But usually, if it's a clinical trial or if it involves patients, the primary REB usually would be done at the hospital REB. And if you're dealing with faculty of medicine students, well, it probably would be the University of Ottawa who would be the REB to review.
I guess I just have one general question, actually, for Catherine, Amy, and Carolyn. If just generally, if you're in the midst of doing an REB or responding to questions from an REB, one can just reach out to you with an email to get a response or to call you. Is that correct?
Yeah, Amy. Go ahead.
Oh, so we have actual huddle meetings, and they're posted on our OSIN REB website underneath the meetings. But there's full board meetings, but we also have a schedule for huddle meetings. So they occur every Monday and Tuesday, I think every second and fourth week, I want to say, of the month. And so they're 30-minute calls that you can request to meet with the chair, myself, your coordinator. And these submissions the requests go to REB administration at ohri.ca general email box, and you would request what type of meeting you would like. And you just provide a short summary of what you hope to discuss, if it's anything contract related, privacy related, consent, something with the application. And then that'll trigger us as well as who else to invite. Do we need to invite somebody from contracts or from the facilitating group, privacy? It just helps us if you provide a little summary. So that's how it's been quite successful to have these huddle meetings, and it's helpful, especially before your submission as well. And it seems to speed things up. So we welcome those short 30-minute meetings.
That's very helpful, Amy. Thank you.
Yeah, for the university, I mean, we have the ethics at uOttawa email. Our coordinator is able to answer a lot of questions, but we also have meetings. We don't call them huddle meetings, but if somebody has questions about an application, we put them in touch with one of the protocol officers, and they can usually help them out with the questions that they have, if the coordinator can't answer those, or me. Thanks. Depending.
Thanks, Catherine.
Yeah, and same for us, where you can email us, and if it's not something that I can help with, then I'll typically ask the chair, Dr. Duval, and we're pretty quick at responding.
Well, Amy, I do have a question specific to you regarding one of our research projects. And since I have you on the line, I will go ahead and ask, and perhaps it's applicable to others. So we do have a OSIN REB approval for a project for an investigator that is affiliated with the Ottawa Hospital, but is not a personnel of the Ottawa Hospital. So not a researcher and investigator. So what happens if now they decide that they want to recruit like folks or participants from the Ottawa Hospital, like for example, at the Civic Primary Care Clinic? Would that require just an amendment and then identifying the investigator at the Ottawa Hospital, or would they need to like resubmit a new application under that the Ottawa Hospital investigator?
So, but you have approval at the Hospital to recruit, like at the general?
We have approval with OSIN to recruit elsewhere, but elsewhere, but participants affiliated with the Ottawa Hospital.
Oh, okay. So yes, it would require an amendment.
An amendment?
Yes, to recruit from the Ottawa Hospital. Yeah.
Perfect. Thank you so much.
And just to give you an example, what we'll be looking for is that, just consent, the participant-facing documents, did we approve them for viewing of TOH patients, or did we make it specific to that community or elsewhere, wherever the study is happening? Like when we approve documents, we approve them for the appropriateness of where they're happening elsewhere. For example, if an investigator is recruiting from UBC, we would make sure the documents are geared towards BC. But if they're for the Ottawa Hospital, then we would make sure that the information is correct for the Ottawa Hospital. So it would require an amendment, yes.
So I don't see any further questions in the chat, and our group is quiet now. So hopefully we will address all of their REB questions and concerns. And now they know who they can email or call to get further assistance with their REB application. And I will include your coordinates in the slide deck that I'll share with participants. I hope you don't mind. So in case they do have follow-up questions. So at this point, I guess we'll close the workshop, and I just want a sincere thank you from the Department of Family Medicine and all of us today for you to join us and answer some of our questions relating to REB, the application process, and everything else.